a lot of people who take their medication correctly and live a healthy lifestyle and see their doctor regularly and really focus on controlling and caring for their condition do very, very well. When you have psoriatic arthritis, it's important to stay on your biologic therapy as directed by your doctor. If you stop your medication, you can develop flares, and then you'll have to restart it again. The problem with doing that, we do sometimes find that it can stop working. Seek medical advice when you develop a flare. Firstly, to find out, in fact, whether it is a flare. If you're on biologic therapy, your risk of infection is higher, and a lot of infections can actually mimic an inflammatory arthritis. If missed, this can be potentially fatal if you're immunosuppressed. Medications that you would take in the setting of a flare are oral prednisone or taking some ibuprofen. However, these can exacerbate your psoriasis. If you see your rheumatologist and you have 1 or 2 joints involved, sometimes you can just have these joints injected with steroids, and that shouldn't exacerbate your psoriasis, because if you just inject your joints alone, a lot of it doesn't absorb into your bloodstream. Certain flares, if you have enough pain and swelling in your joints that it's limiting you from getting through your daily activities, or if it's involving the major weight-bearing joints in your sacroiliac joints or your axial spine or in, say, your knees, then some people might have to go to the hospital to receive IV steroids. But living a healthy lifestyle to reduce the inflammation in your body is important. Stress and lack of sleep can certainly lead to flares. Poor diet can lead to flares, as can lack of exercise and a sedentary lifestyle. Smoking and alcohol are also pro-inflammatory. The problem with any long-standing inflammation is that it can lead to deformities. It's important in the setting of a flare to contact your doctor. There's been a lot of advances in psoriatic arthritis, and our ability to treat these conditions has very much so changed for the better in the last couple years.